Are you ready to go?
Yep.
Okay.
Once he's ready to go.
I would like to welcome you to this resident council meeting. This is our first resident council meeting since February of...
All resident meeting, not resident council.
Okay. I'm so used to saying resident council. All resident meeting. This is not a council meeting. We haven't had one of these for a year, and it's good to be back in this mode of having a resident meeting, all resident meeting. And we do have people here in the audience. We also welcome you, and we welcome those who are watching by television. Since this is our first meeting for a year, and we do have, I checked with Mary Beth, we do have 14 new residents since a year ago. So I wanted to take a little bit of time just to go over the structure of this resident meeting and the resident council. A while back, Timbercrest was visited by the Indiana State Department of Health for an evaluation. And a part of their evaluation was revealing to us that they are in agreement that we are meeting in the right spirit, but that the meetings of the resident meeting, all resident meeting, and the resident council needs to be more directed by residents. And so since we have had that directive from the State Department of Health, we're trying to have the president of the resident council conduct this meeting. This was never done before, extensively, and so today we're experimenting. Also, the resident council needs to direct their own business as well. And so we have now started having, I meet with Deja Long. She is a staff representative, a liaison between administration and the resident council. And we determine an agenda. We share that agenda with the administration, asking them for what they would like to report on. And so we're making a few changes that makes it more resident-oriented rather than administration-oriented. The resident council is comprised of 10 residents. And these 10 residents have to come from certain segments of this institution. 4 of the residents have to come from the neighborhood homes. 2 residents have to come from the option plan, and 4 residents have to come from the full service plan. And so we have a diversity of interest in this particular structure. A resident council member serves for a term of 3 years. They may serve 2 consecutive 3-year terms, but at the end of the second consecutive term, the member of the council has to drop off, at least for a year. We meet once a month. Normally, if it's permissible or possible, we meet on the second Tuesday of each month at 9:30. Residents are invited to come if they so desire. It's not an exclusive organization. And because this year we have, and I'll speak more to this later on, we have 4 residents that have to be filled because their 2 terms end this year. And we'll speak more of that later on. So We are interested in having communication from residents. One of the things that we stress is when a resident brings us a concern, we take it to the meeting. We don't just say, oh yeah, I'll take care of it and then forget about it. And if at all possible, we are encouraged to return an answer to that resident to say that something has been done about it. At least somebody has heard about your concern. So we are trying to have credibility with the residents so that when they say something to us, they can be assured that something will be done with it. It does not mean that you're always going to get the answer you want, but it will mean that it has been taken. For example, just this past week, I had a resident come to me and found out, as he talked to one of the representatives of the fire extinguisher company that checks our fire extinguishers, that the use of fire extinguishers is not necessarily an easy task where you take it off the wall and you just pull a trigger and it extinguishes a flame. And this resident was concerned that for some people, maybe that has impaired hand problems, whatever, they might not always be able to operate the fire extinguisher. This concern was taken to the council, and the council said maybe the best way to handle it is through sometime a demonstration on the Channel 3. So these are things, I only bring this up as one example. I'm happy to say that the concerns of food preparation and food service is declining. It's getting better, we believe. It'll probably never be perfect. We'll never serve the food like you want it cooked. We'll never serve the food in a proper manner as you think it should be served, but we are trying. And so I think it's important for us to realize that your concerns are taken to the council. You will receive some type of a return answer. And so it is with this attitude that we're trying to serve the residents. One of the things that the Indiana Department of Health suggested, that you just don't assume that the administration is going to be there. They need to be invited if they're wanted. So every month when we have a resident council meeting, I specifically go to Stan Noffsinger and Christy Huiras and invite them. That's a known thing to do because without those administrative people there would be no need to have a meeting, because our job as a resident council is to be a line of communication between residents and administration. Administration asks us for opinions. We share with administration their concerns of residents. And so it's an automatic invitation, but there is an attempt every month. I specifically say to Stan and Christy, or if there's somebody else, we'd like to have you in the meeting. Our agenda also shows that if there is any reason for a discussion without the administration, that the administration knows they can be excused from the meeting and the resident council can discuss. Now, the resident council has no power to hire people, fire people, change policy, delete policy, add policy. We are simply a conduit of communication between residents and administration. So Stan is here this morning because I've been invited, and the resident council has invited him to be here. If he wasn't here, we wouldn't have much to say. But at this point, I'm going to ask Stan to come. He asked me, well, what should I report on? And I give some suggestions also. There is a miscellaneous column, whatever else you want to say. So at this time, I'm going to ask Stan to make his report to the residents of Timbercrest.
If you want, that gives you a little more room.
Well, good morning, everybody. It's good to be back with you. For those who are here in the room, it's great to see your presence. For those of you who are home, I'm glad to be in your living room. I wish you could be here. Jim talked a little bit about the Indiana State Department of Health's asking us to do some revisions. Yesterday, you should have received in your mailbox, and for those in the neighborhood homes, it would be the box by your door for Timbercrest mail, a document, a letter from Jim and from me, and also copy of a revision or amendments to the Constitution and bylaws of the resident organization of the all-resident meeting and the council. There are very few amendments that need to be addressed. We've had some title changes that needed to be recognized. We've also had to make it more clear that the council operates on its own and not as a function of administration. So instead of the CEO or executive director kind of running things, which the bylaws and Constitution implied, it puts the president in charge, and then there is a liaison from staff, and that's Deja. The changes in the bylaws and Constitution reflect the required changes that the Indiana State Department of Health mandated upon us. Now, you all are used to the Indiana State Department of Health because of masks, and for staff, we have to wear goggles still. They can also affect our governance, which is how they entered into this document. They are doing this to assure that you as residents have clear pathway to organize and to bring your concerns without any interference from administration. Now, I'll tell you, when the auditor was here and reviewed minutes of our resident meeting, minutes of the resident council and our structure, she said, and I quote, "Timbercrest has historically operated in the true spirit of what the law requires. So we've done a good job." Then she said, "But your structure doesn't reflect the legal part that has to be met." So that's what we're doing today. At the bottom of the letter that you received yesterday is a ballot. And what we're asking you to do is, if you will support these modest amendments to the Constitution and bylaws, that you put your name on the line. And for those of you where there are two people in the apartment, put both of your names separately, and you may mark that box, yes, I will approve it, or I will not approve it. You can make 2 check marks, but both names have to be on the line for us to accept 2 check marks. Okay? I hope that's clear. 2 people in an apartment, put both names, and you can vote twice and we'll tally. If only one person puts their name and there are 2 check marks, there will only be 1 vote counted. All right? So that's number 1 on Constitution and bylaws. A second piece on that letter is something that came as a request from a resident to administration and to the council, and we decided to put it out to you. This individual said, would it be possible for residents to have the email addresses of other residents? So we've talked about this at length. We know this has been brought before the council before, and now we're bringing it to you. If you are willing, and this would be a separate sheet that would only be made available to residents on the property. This would not be up in the foyer where we have all of our marketing materials. This would only be something that we would hand out to those who give permission for their email addresses to be published. If you are willing, to give your email address to other residents on the property, please mark at the bottom of the page, yes, I will do that, no, I will not. And if you say yes, would you please include legibly your email address? We will only put together a sheet of those individuals with their name and email addresses for those who say, I give you permission to do this. So those are the two pieces on that letter that I would ask for you to respond to. And please, if you don't want us to publish your email address, please put your name on there and say, no, I don't want to do this. Both votes, yes or no, I will or will not, are important to us. We will honor your wishes. So those are kind of business items. I wish we were together, so if you had questions, you could ask them. I'm going to ask the people here in the chapel if they have questions on either of these two business items. Do you have questions? Hearing none, seeing none of the, 15, 18 people here, I think we'll move on. Christy's going to talk about a remodeling project that's coming up, and you may have already seen some activity around it, and I'm going to let her share the details of that project because it's really an operational issue. But I wanted to assure you that the remodeling of the snack shop, the neighborhood market, and a closet adjacent to the neighborhood market is going to take place. I can imagine that you're all saying, oh my, and this time, how are we going to pay for this? And I want to reassure you that the closet, which is going to become a 24-hour, 7-day-a-week, 365 days a year canteen where you can go in and purchase food, drinks, coffee, any time of the day or night, through vending machines. And then the snack shop's remodeling is all covered by our contract with Morrison Living. Inside that contract is an agreement that $225,000 would be made available for improvements to facilities related to food preparation and food delivery. Of course, we use the snack shop for lots of things, but we're going to be using it for the food, the dining advisory group. Hold on a second. For the dining advisory group, it will be used for the teaching kitchen. It will be used for church meals, birthday meals. It will be used by program and service. So lots of activities that you're used to will continue there. But we are going to make it a rather beautiful place for your enjoyment, including a pergola out over the patio with more tables and chairs so that you can take your coffee and go outside and sit on the porch, if you will, and enjoy the beautiful, beautiful courtyard that we have. Again, I want to name that the majority of the cost for this remodeling is covered under our contract with Morrison. It is not a new and additional fee that we're going to have to figure out how to come up with. It's already taken care of. So I'll let Christy speak more to that. We're excited. We have some beginning architectural drawings that we're not quite ready to share publicly. We are going to sit down with program and service to work through their thoughts about the space. We're going to sit down with all of the volunteers at the neighborhood market to show them what we're proposing so that their input can be added to the drawings before we begin. So we're going to have a lot of involvement of residents in the process as we move on. This past Saturday, the Timbercrest Board of Directors met again by Zoom. Zoom has been effective for the board of directors. We've had really, really good attendance at those Zoom meetings. For a long time, I think 3 of the 5 we had 100% attendance, and now we've had an absence at the last 2. People have other things to do, and they have to be responsible to their families and to their jobs, and we understand that. But the meetings have been very, very good. Byron reported on finances of Timbercrest for the first quarter of 2021. We have to say that we received a $480,000 performance payment from Department of Health and Human Services for the outstanding job that we have done on infection control. You wonder if it's been worth it? Well, that $480,000 actually made it so that the first quarter of this year we broke even. We had a balanced budget for the first quarter, and we're very grateful for those funds that have come from the federal government. Now, I would be remiss if I didn't say to you, the residents, thank you, especially inside this building, Healthcare, Crestwood, and Manor residents. Your help with staying healthy and following the guidelines that we've had to live with, and also to the employees who have done a great job. We wouldn't have gotten that kind of a reward for an outstanding job. More times than one, people have talked with me across the state and have said, how'd you do it? You only had 10, 11 residents sick. You had 1 death. We do the same things you do, and we had a whole lot more, and that's been the case. So I'd love to be able to say, we all did it, congratulations, but I also have to say that we've been afforded a bit of grace. I don't know what it was. Maybe it's being where we're located that helped us. But nonetheless, we are at the top of the heap on infection control, and we've been rewarded generously by the Department of Health and Human Services. This is the 3rd such payment over the last year, rewarding Timbercrest for its performance. The other thing that we had a report on was a report on our investments for the endowment fund by First Financial Bank. Folks, all the low-picking fruit that you could ever expect off the market has been gained, and we've been very fortunate at Timbercrest for the gain on the investments that we have, and we recognize that. Byron and Christy and I are now talking with the Finance Committee on how do we protect those gains. Don't just leave them in the market and keep them invested if you have any suspicion of the market not performing well. So how do we protect the gains? So we're looking at that. It was a substantial amount of return on our investment. We're very pleased with that. The board also took action to establish a corporate compliance committee. What? Well, you've heard of Indiana State Department of Health. You have heard of the Center for Medicare and Medicaid Services. Now you're going to hear about the Office of the Inspector General. Because we participate in Medicare and Medicaid, we have to comply with public laws about ethics and proper business functioning. So a compliance program, which has been in place, Christy has been doing a great job leading it, is in place, and it is a way by which anybody can contact either Christy or go through a compliance hotline to report suspected fraud, abuse, ethical violations, and those are then dealt with administratively by our compliance committee. We recently had a mock audit of our compliance program. And again, it was found that Timbercrest functions in the spirit of the law. We found from the surveys that were done of employees and also the board that, yes, people know about the compliance program. Yes, they know how to report problems. Yes, they believe that when a problem is reported, administration will act on it to correct it. So the auditor said, you've got the right spirit. Now we knew the next part. They said, yeah, but you don't have all your paperwork in order and your structure. And so we've acted on that. The board approved an ad hoc corporate compliance committee and appointed members to that committee. Gretchen Gibbs, who is a new member to the board of directors, is an advanced registered nurse practitioner, and she is the corporate compliance officer for the multi-facility, it's a large corporation of healthcare services. So she knows full well what corporate compliance is. She is an educator nationally on the issue, and she's on our board of directors and chairs this new committee. And we look forward to her assistance with the board and for us during the next audit, mock audit of our compliance program, of hearing that, yes, you live in the spirit of compliance and your structure and your paperwork is all in line. Christy and I are meeting this afternoon to go over that audit and to formulate a plan of correction that we will put in place within the next 30 days. The board also has approved a strategic planning process. We have some challenges ahead of us. And the board setting a vision for Timbercrest is really important. It gives guidance to me as the CEO and as I work with the staff. We're projecting into the future. How is Timbercrest sustainable? And that's part of the board's responsibility. They have already engaged Blue & Company, our auditors, to do a financial evaluation of each of the housing modules that we have: neighborhood homes, option plan, full service, healthcare, and Crestwood, to look at the sustainability of each of those areas of service. Can we keep doing business as we have? Are the number of beds that we have or apartments that we have the right mixture for the Timbercrest community? Well, the Blue & Company is looking at the financial aspect of those questions. Mennonite Health Service is working on the operational side to evaluate how we work as your staff and how effective are we at managing these lines of service delivery through the different apartment types that we have. I want you to know that in the coming months, you might expect to receive a survey from either the board or from Mennonite Health Services, because your input as residents in this, your home, is critical to the development of a strategic plan. So if you see something come through your mail and it's a survey, don't just throw it away. Look at it, make sure it says Timbercrest on the top. Fill out the survey, please. That information is going to be important for us. We hope to finalize and implement the plan not later than the November board meeting. I've talked a little bit about occupancy, and it's a challenge. All of us know that as you walk through this building, it's obvious we have more apartments now than ever in the manor that are empty. And what are we going to do about it? Well, for the last 16 months, we couldn't do a blooming thing about it because of the quarantine and the isolation that was imposed on us by the pandemic. The numbers are staggering, and I think Christy and I would name, and Byron would say, that this issue is what keeps us up at night. We're very unsettled by this. So if we look at our different service levels, how do we add up? Well, in the neighborhood homes, we have 79 units. And as of the end of March, 73 were occupied. That means 6 were unoccupied. But guess what? All 6 of those unoccupied units already have leases signed on them, and we're in the process of remodeling, and we will see move-in, which will bring well over $1 million worth of entrance fees for the neighborhood homes by the end of July. That's good news. The neighborhood homes are our strongest selling point right now. Option plan apartments, at the end of March, 55 of 64 were occupied. That means there were 9. That's not too bad. Full service plan, 36 of 68 were occupied, meaning 32 apartments were empty. Now, when you add those two together, that's 41 apartments in the manor empty. People haven't wanted to move in here. And it's not a problem of Timbercrest. Every long-term care facility in the state of Indiana and across this nation is facing the same dilemma. We're not alone. People have opted to stay at home and get care at home rather than face the isolation. And I think those of us who have been inside the building really understand that, don't we? But it does create a conundrum for us. What do we do moving forward? That's the challenge the board and your staff are facing. Healthcare at the present time, we have 42 of 49 beds filled. That means 7 are empty. Why? Well, we continue to have at least 4 that are saved for COVID-19 patients. Now, that doesn't sound too bad. Let me put it in perspective. Up until about, Christy, was it a month ago or so, we had to have a whole wing for COVID-19. That was 14, 15 beds empty. What's the financial impact to Timbercrest of those empty beds? $150,000 a month. Empty beds in healthcare. And the state said you can't do anything except COVID-19 care in those beds. So we got stimulus money, remember? We ended up last year pretty well, kind of balanced out. And we got this $480,000 this year. And that's really helped us offset COVID expenses and those empty beds in healthcare. It has not necessarily helped us with the empty apartments in the manor. And mark it as we would, finding people to move in has just been terribly difficult. So we're looking at that. One of the options that many facilities are looking at is delicensing a wing and making it like a neighborhood apartment, like a neighborhood home. So it would not have access to health care, it would not have access to personal care or services. It would be just like a neighborhood home, but an apartment. Not saying that's where we're going, but a lot of my colleagues are making that change. The Brethren Retirement Community in Greenville, Ohio, their CEO is a good friend of mine, and at one time they had 195 beds in healthcare. They have reduced their size, taken over 100 beds to independent living. Now they only have 90 beds in healthcare. That's huge, but that's what's happening in the industry across the United States. And it's a challenge for the board of directors. So keep your eyes open for those surveys. We would love to have your ideas on how we can address some of the challenges. I know from my perspective, some of you heard me last week talk about, neighborhood homes. I'd like to build some more of those. Well, that's the board's decision and not mine, and I'll put forward that idea and we'll see where they go with it. Timbercrest also has the Plaza Commons, which is a 16-unit apartment complex down next to the grocery store, the yellow apartments. They're full, and that property is doing fine. It is covering all of its expenses, and it continues to be very popular and serving the people who are 55 years of age and over, who may not have resources enough to enter Timbercrest. So that property is doing well. This property is not funding that. It's caring for its own. The Sheets property, which all of us wonder about, is still for sale. We've had no offers for the property. But as you know, Metzger auction has been in it now for, a year and a half, and they're doing very well. The property and the rent that they are paying to us through their lease covers our expenses there, and for that we are most grateful. So that's kind of an overlook of the board meeting. Last Thursday, if you were on the phone, you heard Brian ask me about bats in the belfry. And what's that have to do with Timbercrest? Well, we've been negotiating for about over a year now for a cell tower to be constructed on the northernmost end of our property. As is the case when something is under being thought, there was a legal challenge to it, and the town of North Manchester and the developer were challenged legally. That's now all been taken care of, and it's out of the way. So I called the developer and said, "Why aren't you starting?" And he goes, "Bats?" The Indiana Department of Resources has declared that bats are a protected species in Indiana. During the months of, I think it's March through September. And during those months, you can't go in and cut down trees in a woods in any great number because you're disturbing potential habitat for bats. And I had a bat in the house that I'm living in a year ago, and frankly, I don't want to disturb their habitat because they might come back and visit me again. So we want to keep them up there. So for now, the developer is talking with the Department of Natural Resources to see if that applies to our woods, because the next steps for them would be to cut down trees to give them access to the site, to do environmental and geological studies to see if the site will indeed hold the cell tower. The cell tower will be less than 200 feet in the air, which means it will not have lights on top of it. It is below the required height, so we aren't going to have strobe lights or blinking lights that will affect us. But it will bring 5G service almost to any place on property, which will be a welcome change for all of us. And it also brings a modicum of rent income to us for, I think it's about a 75 by 75 square foot piece of property where a tower is going to be constructed. Jim, I think for now that's plenty, and it's my privilege to serve you as CEO of Timbercrest. And again, I want to thank you for all of your support, for all that you have done to help us get through the pandemic, and now as we look to a brighter future for all of us. Jan, you have a question?
I have a question about what the rationale is for a bell tower.
For what?
A bell tower. Bell tower.
A bell tower?
Isn't that what you're talking about out here?
No, a cell, C-E-L-L. Telephone cell tower, sorry. Excuse me. A cell tower, cellular tower. Thanks, that's a good question. Good. Does that answer it? Okay. Any other questions? No. It goes down at 1450? The county road that turns to the left is the northern end of our property. And 200 feet in, there is a knoll. that kind of sets up. You can barely see it, but if you walk out, there is an access road already there that we had. You can walk out and see where it's going to be. So it'll peak up above the trees. But it will not be visible from East Street as you're going north. Coming south, you'll see it from a distance, but it should not be obstructive or an eyesore for us. Yes?
Will our present cell phones then work on various, on certain brands, or will this be a separate system?
The question is, will our cell phones work on this tower? Excuse me a second. I don't know about you, but every once in a while these things tickle my nose. The cell tower service will be an AT&T tower. And I think a majority of us have AT&T. Now there are some other services, other companies that use AT&T bandwidth, and I'm not certain of all of those, but that's who the cellular provider will be. Yes, Dick? Will it improve the television? Well, if you stream over your cell phone, yes, significantly. That will not affect at this time retirement TV on the property. Oh, that's a good point. I want to tell you that we are working on two items feverishly right now. One is internet service to the campus and neighborhood homes, and two is cable TV. And we are negotiating with two different companies right now to get us bids that we like, so that we can greatly underscore double, triple times, greatly improve your internet service and also cable TV. Currently, our maximum internet is about 25 megabytes with each apartment, and that's it. And that's a limitation of our wires on our campus. We are looking at a basic coverage of 100 megabytes up and down that will be included for all residents, and the possibility of a new cable TV service that will also be installed. And currently we are looking at fiber optic rather than traditional cable. And we have a very, very good company that we're excited about, and we're waiting on the return of their bid. Yes?
When will the people outside in the family home be able to come in and have meals in here?
Question is when will the people in the neighborhood homes be allowed inside for meals? I don't know, Dick. That is governed by the Indiana State Department of Health, and at this time, the only people that we can allow in the dining room are residents of the licensed care facility. And we don't have any option on that. Almost everything that we do inside the manor is governed by the Indiana State Department of Health. And I'll tell you what, it changes weekly. And we don't know. I mean, next week you could come in, or maybe 3 months from now. A key that you might keep your eye on personally is the Wabash County infection rate. And the Indiana State Department of Health has a COVID-19 website that shows the infection rate for Wabash County. And just know that the critical factor for us is staying under 5%. For all of us, for employees, for residents, for everybody. And if it goes up over 5% and then over 10%, each gradation of 5% imposes new regulations on us automatically. We have, Timbercrest staff have a specific website that we have to go to that's other than the public one of the Indiana State Department of Health. Can you imagine that? But there's a very specific one that we have to watch. It often lags a week behind the Indiana State Department of Health. So If you see us saying, oh, the infection rate is X, and you saw it last week and it's changed this week, wait a week, it'll change. Just be patient with us.
I have one more question.
Okay?
Okay, the new canteen that you're getting ready to have down here, or whatever it is gonna be, will there be vending machines that are available to the residents outside?
They're available to the residents as long as you're able to enter the building. Yes.
How about outside? Why not have one where you can have access to time?
One step at a time. Getting it inside the building for use. It's been one of the, if you will, Achilles heels of the Timbercrest community that so many things are inside this building. And we only recognize that because of the pandemic, right? No access to the dining room, no access to the exercise room, and the list goes on. We do want to address that for neighborhood homes in the coming months. We would love to see like a neighborhood homes club room that would have some exercise equipment and some access for space that wouldn't be governed by the state license. How and where we do that is a piece that we're now looking at. We recognize that that's a deficiency, Dick, and we'd like to address that in several ways for the neighborhood home residents. All right, Jim, I'm going to call it quits and turn this back to you.
Thank you, Stan. As you've heard his report, that is one of the purposes of this meeting, is so that you and we know where administration is trying to take us. And one of the requirements of administration is to have some visions. And good administrators will have visions for their institutions. And I feel very comfortable that we have all administrators are visionary people. And we're just not sitting and saying, well, it's always been done this way, and that's the way it's going to be done. So I want to put into the program here that normally, if we were under normal situations, we would be introducing the new residents. As I implied before, according to the statistics of Mary Beth, we have 14 new unit residents since a year ago. Normally, we introduce them to the residents of Timbercrest, but because of the restrictions, it does not make it seem possible to do that today. So we're simply saying, if you are living close to a new resident, make them feel welcome. Don't just walk down the hallway or out in the street and say nothing, but at least smile, welcome them, whatever. Because I know that when people move, no matter what age we are, when people move, there's always questions. How am I going to get along? And who's going to become a friend? We still need to make friends with people that are new and keep our friendships with people that we've done that with for years. So we encourage you, seek out the new residents, extend a hand, smile. We can't give them a hug because that's not allowed anymore. But at least make them know that they are wanted and needed. The next item we want to address is, and this has been put in the Timberline, but Resident Council felt it was important that we reemphasize today this area called the Code of Conduct. This was written up in the Timberline, but we know that not everybody reads the Timberline. And we know that not everybody's listening to this presentation today, but we simply want to reemphasize to you the Code of Conduct for employees. This is not a code of conduct for us. Indirectly it is, but it's more addressed to the employees, so if they understand the conduct that is expected of them as employees. And I want to read the Code of Conduct and then make a few comments. Code of Conduct and Resident Gifts to Employees. Now we know that wherever we're in the manor or in in the neighborhood home, we develop close relationships with employees, and that's good. I think that's a strength of this institution, is that the employees and the residents are closely united together. We develop close relationships with employees, and to show our appreciation, sometimes we want to go overboard and maybe do something special for them. Well, we need to know that the employees have a code of conduct, and it says, you as the employee, you may not accept any tip or gratuity from residents, and you may not receive individual gifts from residents. You may not give gifts to residents. You may not borrow money from nor lend money to residents, nor may you engage with residents in the purchase or sale of any item. A team member may accept any gift from a resident under a will or trust instrument, except those cases where they are related by blood or marriage. Again, we just need to be, Resident Council encourages us to appreciate the people who serve us. Yet we know we also have an avenue for that, because every year we are encouraged to make a donation to a Christmas fund for employees. And that's permissible. But the Christmas fund is evenly dispersed to the employees based upon length of service and I think some other criteria which I'm not totally acquainted with. But I think it's important for us to realize that we don't want to put any employee in jeopardy of offering them something extra for their service. Maybe it's a thank you. Maybe it's a conversation. But we cannot offer tips, gratuities, or anything of money origin. And so we are just reinforcing this particular code of conduct that was printed in the Timberline, but we just wanted to be sure that we would reemphasize that. I mentioned earlier that the Resident Council is going to come up short 4 members in December. There are 4 council members who have served their 2 terms and cannot serve any longer. One of the vacancies comes from the option plan, so we have to replace one person to take the vacancy and unfortunately untimely death of Ruth Ann Angle. She was a member of the council, and so she, because of her unfortunate accident, has left a vacancy. There would still be a vacancy in November if she were alive. So we need to find one person from the people who are on the option plan. We need to find 3 people to take the place of 3 residents of the neighborhood homes. Joanne Shaw, her term ends. Marie Willoughby's term ends, and my term ends. And so we need to come up with 3 residents. Now, how are we going to handle this? Well, we are in the process, and we have already started, we being the Resident Council, has already started formulating plans and nominations. Just last Tuesday, the Resident Council, we went through the list of option plan residents, and we went through the list of neighborhood home residents, and we checked, marked people we thought might be good candidates. But the selection of candidates can not only lie within the Resident Council. All residents have to have that opportunity. So working with Deja, we are going to be prepared next Tuesday in the campus mail, both in the manor and in the neighborhood homes. You will receive a list of those residents on the option plan and those residents in the neighborhood homes. And then you will be able to check mark anybody that you think is a good candidate. Now, you cannot nominate somebody unless you have their approval. And that's essential. You just don't say, well, I like Joe or Sally or whoever, and I'm going to put her name or his name on the ballot. You have to have their approval before, because when you call me and tell me who you want to nominate, I'm going to ask you that question. Did you get their approval? Last time we did this, we announced it, we still had people say, well, I want to nominate so-and-so. Did you ask them? No. Well, I went and asked them. I said, I'll take care of it. I don't want to do that because that's a lot of phone calling and making visits. I got the time to do it, but I think it's your responsibility to do that. So you will then receive next Tuesday, and I just met with Deja this morning. She's ready to go with the list. On the list will have the names of the residents in those two categories, and there will be check marks by the names that have already been nominated. So if you think Alice is a good nominee, and if she's got a check mark by her name, that tells you she's already been nominated, so you don't need to do that. Now, you may nominate cross lines. If you live in the manor, you can nominate somebody in the neighborhood home. If you live in a neighborhood home, you can nominate somebody in the manor. You're not just limited to where you live as to who you can nominate. We will then comprise a ballot, and the ballot will be ready for hopefully our next resident council, I still struggle with calling it council, all resident meeting in August. There will be a ballot prepared for you then to vote. We will use this, and we'll explain this more in detail, we will use the rules of simple majority. And we've double-checked this twice. Simple majority simply says that the person that gets the most votes does not have to have the majority, but gets the most votes is elected number one. The person that gets the second highest votes is number two. The person that gets the third highest votes is number three. Now, that doesn't account for ties, so we have to be prepared maybe to have a runoff election. Let's say that 3 and 4 are tied. 3 and 4 that got the most votes in third and fourth position, well, they're tied for third, so we'll have to have a runoff between those two people. And that's why we want to do this in August, so that we have time to be prepared for these people, these new members of the resident council, to start in December. So you will be getting in the mail, campus mail, next Tuesday, the two lists. And the instructions, there's a cover letter with these lists. Read the cover letter, please, and do what it says, and we'll get along very smoothly. So we simply want to make you aware that we are working on that particular project right now. We've invited Christy, COO. There's a lot of acronyms in CEO, COO, CFO, and what do those mean? They work here. They have a specific job. Christy's job is Chief Operational Officer. And so we're going to ask Christy to make comments about things in this institution that relates to her job description. Christy?
Thank you, Jim. It's good to see everyone here again. I don't have a lot to report on. We have been diligently working on a couple different projects, and one of those I'm just going to talk to you a little bit more about Morrison and our relationship with them and how things are progressing. We, over the last several months, have welcomed a new dining director, Stephen Watkins, and he is doing a great job. He meets with me weekly, and we talk a lot about his ideas and how we can make our dining experiences here better for everyone. One of those things that have implemented over the last several months is a dining committee of residents who gather together once a month with Stephen and Amanda and Chef Corey. And we talk about, or we hear back from residents, the feedback that they have about the meals that are being served and any other kind of dining related issues. And that feedback then is being very well received by those managers and being addressed and timely. There are new comment cards that are being placed out for you to be able to make comments on. It is helpful if you'll sign those comment cards. It is optional, but if you sign them, then if there are any questions, those managers can get back to you and ask more detail about your concerns and even follow up with you later to make sure that you think those concerns have been addressed appropriately. One of the new ventures really that Morrison has really helped develop is this teaching kitchen. It's a new experience that residents are able to come, they're able to sign up for first of all, because it is a limited space and residents can come and be presented with an opportunity to make a dish in the presence of the chef leading them. Chef Corey and Patty Avery hosted the last event, and which was our first event, and it was very well received. They made a homemade poppy seed dressing and applied it to a fresh fruit salad, and it was very good and delicious from the feedback that I heard. And so it'd be opportunities like that for you to experience something different and new. Those will, again, be monthly, and we will, because the space is limited, broadcast them on Channel 3 as well. That is our plan at this moment. As Stan mentioned earlier, we are also excited to talk to you more about some of the updates that we're planning for the snack shop area and over by the neighborhood market, that canteen. In the snack shop, we are planning to redesign that area. So you'll see it, the orientation of the room likely shift. And we're also going to call it the Chef's Nook, because we'll have more opportunity to use it for these teaching kitchens and some other events where the chef can actually prepare a meal there if necessary and desired. There'll be plenty of counter space in that area. There'll be a couple refrigerators still there. We'll be able to have an area where we keep cold foods cold, and we'll have an area where we can keep hot foods hot. And there'll also be what we call an induction stovetop, where we'll be able to cook dishes there too. So there's a lot of opportunity and flexibility in that space. There'll be storage areas for the things that need to be in there. Excuse me. But not too much storage capacity so that we're overcrowding the space either. There'll be an area where we'll have a microwave, which is a new feature in that space. We've not had a microwave, to my knowledge, in that space at any time. And we'll still have coffee available for those of you who wish to have coffee. As an extension to that room, we're planning to utilize that patio space a little bit better. Right now, it's just out in the open, the sun shines down, it's hot in the summer. What we're planning is to put a pergola up that gives plenty of shade and an ability for residents to take their meal outside, maybe something that they purchase in the canteen area and want to take out and have a snack with visitors, or staff who wish to purchase something and go outside and enjoy that space as well. As you know, our courtyard area is a beautiful area, and that'll be a great view and opportunity for us. In addition to the Chef's Nook across the hall over near the neighborhood market, as Stan pointed out earlier, we're going to utilize a closet space to put in various vending type services. So we'll have plenty of snacks available. We'll have some fresh sandwiches and salads and maybe some other kinds of meals that you might be able to heat up. But it'll be a contained space. It's supposed to be available 24 hours a day, 7 days a week, so that any time of day or night, if you're in this building, again, to address Dick's comment, neighborhood homes residents are able to access the building during the day, but not necessarily after hours, so to speak. But those features are there and available to staff and residents to make use of. There is going to be, the design, any plans allow for a self-serve payment system too. It'll be a cashless payment system. And so that things can be purchased at that location and then taken home to eat and enjoy, to take out to the the chef's nook patio area, however you wish to enjoy those treats. The neighborhood market itself will get a facelift. It has been in this building since about 1989, and it's in its original state. So all the furnishings are showing their age, and we know that this time period that it gives us an opportunity to do these projects kind of simultaneously in some fashion and get that area, really give it a good facelift. And in that process, we'll put new shelving units in so that it looks more aesthetically pleasing when you come in to shop. Still carry the same types of gift type items, gift greeting cards. We'll have still some of those market type sundries, milk, toothpaste, anything, Kleenex, things like that will still be in that space. We're just going to redesign it and make it more pleasing to everyone involved. So we're very excited about making these changes, and as Stan alluded to earlier, the way that we structured our agreement with Morrison when we contracted with them, the canteen and the chef's nook, those costs are really already built into our services here at Timbercrest and are no additional cost to residents. So feel confident that your bill each month is not going to go up because of these enhancements. Really, I think that's about all I have to share as far as Morrison goes. Another change that you'll be seeing, and that we don't have all the details ironed out yet, but it's to address a concern that we've heard over the past few years about security in our building. And due to COVID, we've already locked our exterior doors so that we can funnel all of our traffic through one or two areas within the building. So what we're doing right now is also extending some of our secure door features to the hub and the front entrance. And for the time being, we're going to try to screen, and we'll make an announcement when this takes place, but the idea is that anybody entering the Manor building will have to screen in just like they do on paper right now. But we have electronic tablets set up to be able to do that for us, maybe more efficiently. But then also the doors, because of COVID, again, we have to make sure to monitor inflow. So we also have door access cards that have been issued to staff. We're trying to work out how that works for residents and being able to come and go as you need. The design is that residents who live in the manor will not have to screen in if they have an access card. So we're trying to figure out who might need those and how that will work. So more information will be coming to you on that. If you have any questions or concerns about it, feel free to come to me, ask me questions, and I'll try to help you with those. Anybody have any questions?
I'm full of questions. And this is something I think that I've wondered all along. If someone from the outside, well, if we have a maintenance request after hours, of course, 2118 rings and rings and rings. Or if someone from the outside were trying to reach Timbercrest and really needed to talk, I mean, should we give them all the nursing phone number? Those are two questions I have about 2118.
Okay, when you dial the main Timbercrest phone number, the 982-2118, after hours, so after 5 p.m., the phone is switched to a night system. And that night system is a recording, and it does probably take several rings to get to that recording, so be patient. But that recording tells you different options to choose from. Excuse me, I have a terrible tickle. And so those options will lead you, and I do believe the very first option has to do with nursing care. You can opt for nursing right off the bat because they're the only ones here in the evening to routinely be at the phone. So, Jan, are you saying that when you call the 2118 number in the evening, you don't get any recorded message? Jan, do you get a recorded message?
I'll have to try that again. I don't believe, I mean, the message just says it's not available. I'll have to try again.
We'll check into it as well.
Yeah.
Good question, thank you. Did I answer both of your questions now? Okay. Anybody else? Okay, I see none. Well, thank you.
Thank you, Christy. We want to close here quickly because it is 11:15. I have a trivia question. Christy's talking about security. Does anybody know how many exterior doors we have in the manor? Now, Marie, you can't answer because you heard this.
87.
How many?
87.
Now, you're a little too high. We have 42 exterior doors, and that's what Stan told us. So if we're wrong, it's his fault. But you can see the point of security. I go to a church that's locked. The doors are locked every night, but about 500 people have keys. Now, how secure is that church? We don't even know who has the keys. And so security with us is very important, and we understand that. I would like to end the meeting on something that's been on my heart for a while as president of the resident council. Most of the time, people that talk to me always have a concern, and concerns are welcome. I don't want to say to you that don't bring me concerns, but concerns are welcome. But it's nice when somebody says something nice.
You did a good job this morning.
Well, I'm not asking for that, Dick. But I am saying, and we've heard on resident, getting employees is difficult today. And for example, we lost a healthcare worker to a big hospital unit in our locale, because that hospital paid her $10,000 more as a sign-on bonus. Now, do you want us to get into a competition and say, well, we'll go 11? You know where it's going to come from? It's going to come from our pocketbook. So we're asking the staff to fight that kind of battle. I go by McDonald's out here somewhere I did. They got a $500 sign-on bonus just to work at McDonald's. We live in a protective environment, and I don't know if I always know what's going on in this world. But the world is not a pleasant place in terms of getting good people. We want to keep good people. Every so often, I have people come to me and say, well, how about our monthly rate? It's getting too high. How do we keep the monthly rate down and still give good services? Now, we can't give every service, because when I was on the hospital board, Wabash Hospital, we never considered doing brain surgery at Wabash County Hospital because we weren't equipped for it. We can't do every service everybody wants. We need to try the best we can. I think we need to be appreciative of what we have. I'm not saying that Stan and Christy and Buddy Brun, I know him as Buddy, that's what his name was in high school. Do everything according to what I want. And that's true with all of us. Nobody does everything that I want, but I need to be appreciative of what I have. And I think we are blessed. We are blessed beyond doubt that we live in an institution that takes care of its people the best they can with the resources that they have. We need to keep good people. And to keep good people today in today's marketplace, we got to pay more money. And where's that going to come from? It's going to come from increased rates. And I know the management, I've spoken with Stan about, they're concerned about the rates. Last year we had the biggest rate in my 9 years of living here, $57 a month in the neighborhood homes. And some of you that live in the manor had bigger increases. So we just need to be, I think for me, I subscribe to a paper called Epic Times. And Epic Times, I get it once a week. And I get it because every time there's a good story in there that's positive. And it makes me forget about all the negative stuff that's happening in this world. And so we need to have the good stories. We need to have, I appreciate you, thank you. Maybe I don't agree with you always, but that's okay. That's okay. Heavenly Father, we are thankful for this day. We're thankful for this time together. We pray that those that have been here in attendance and those that have listened are better informed. And we pray, Lord, that we know that we can trust our management, even though maybe we don't always agree with them, but we can trust them. Trust them with truth and honesty. We thank you for this time. May this meeting met its purpose. In Jesus' name I pray. Amen. We're dismissed. Thank you, everybody.